Hi, I am Dr. Bindu Menon. I am a neurologist from Apollo Specialty Hospital, Nellore. Welcome to our stroke prevention campaign where we are focusing on one risk factor every month. And November month is dedicated to salt. Excess salt consumption is related to hypertension. An average adult Indian consumes more than 2 times of the WHO limits of the salt intake. In fact, Indians on an average 9% of globally excess of salt intake is there. An average Indian is allowed 5 grams of salt per day if he does not have any other risk factors like hypertension, diabetes or other risk factors, cardiovascular or stroke. So how can we go about it, and how does salt relate to a hypertension? Salt leads to, for simple to put it is, salt leads to increase of water retention in your body, and also it causes increased resistance of the blood vessel. That is, the blood vessel's elasticity becomes more rigid and the heart has to forcefully pump the blood in that rigid blood vessels. It is easy way to find out how much you are consuming salt. It is very difficult for an average to know that how much you or me are consuming. So if there are 4 members in a family, what one can suggest is, if there are 4 members in the family, then if there are no other risk factors, say 5 grams of an average adult is equal to 1 teaspoon. So you take 4 teaspoons in a small bowl, and for that whole day you use the salt for any form of cooking or any other thing which you are taking as an extra salt, sprinkling anything, you use from that small bowl, that is at 4 grams of salt. If for the day you have consumed that much amount of salt and you have not taken any extra packets, that is any of those packed items which would contain an extra salt, you would have an average idea of how much you would be taking. Because as I said, an average Indian, almost 9% of globally is an excess salt of around 10 grams of salt, that is 2 times of the salt intake. Try it once at your home, one day, so you will have an average idea of how your salt consumption in the family is, and also to make sure that who is taking the extra portions of food, he would be getting the extra salt also in the diet, and see that. Restrict your salt to the required amount of salt intake. Prevent hypertension, prevent stroke. Follow our stroke prevention campaign for regular updates. Thank you.